More than 1 million coronavirus cases reported around the world, nearly a quarter of them in the United States, plus job numbers continue to tank. Hello, I'm Mike Walter, sitting in for Anna Naidu, and this is The Heat. It was another bleak day as COVID-19 continues to claim more victims. In the United States, it took a month and a half for the first 100,000 cases to be registered. The total has now surpassed 270,000 in a fraction of that time. At the White House, President Donald Trump and his coronavirus task force continue to grapple with how to treat and prevent more infections. For the latest, we turn to CGTN's White House correspondent Nathan King.
Yeah, Mike, good to see you. The big debate about masks and whether or not to wear masks did continue up until that briefing, although they're not calling them masks. Essentially, what the new advice is from the White House and health officials is that Americans should wear facial coverings. The reason they are not saying masks is because these N95 masks are in very short supply here in the US. They're meant for frontline healthcare workers, and the US president, while announcing this, also said he wasn't going to wear one. Let's take a listen.
The CDC is advising the use of non-medical cloth face covering as an additional voluntary public health measure. So it's voluntary. You don't have to do it. They suggest it for a period of time, but this is voluntary. I don't think I'm going to be doing it, but you have a lot of ways you can look at it as follows. The CDC is recommending that Americans wear a basic cloth or fabric mask.
Now, apparently that follows new advice that obviously asymptomatic people can spread the virus, but also that it perhaps, according to the advice that we heard in the room from the US Surgeon General, is that the virus can hang longer in the air than they thought. So obviously a worrying development, but it is a voluntary recommendation. Also, Dr. Deborah Birx, who of course is part of the coronavirus health team, saying that she's also worried about other areas, not just of course the epicenter in New York and elsewhere like Detroit and Louisiana, but also Pennsylvania and other states as well. So we are starting to see more cases in more places, Mike.
Yeah, it's really interesting, Nathan, this contrast, because I remember Wuhan, one of the news conferences we had, all the health officials had the masks. President Xi, when he went to visit Wuhan, wearing the mask, but today, President saying he's not going to do it. But Trump and others, we're talking about this as a global crisis. Are there any signs at all that the United States, China, the rest of the global community might start coordinating more closely on efforts to combat this virus?
I mean, US President Trump has said, generally that he would like to. Behind the scenes, for example, his son-in-law, Jared Kushner, has been organizing airlifts of supplies from Asia, including China, rather than just shipping them, which takes longer. And there have been diplomatic channels. Diplomatically, things have calmed down between Washington and Beijing, but the US president has taken some incredible measures, and it involves these masks as well. A huge public spat with 3M, the maker, one of the biggest manufacturers and distributors of the N95 mask. Basically, they accused 3M of diverting supply to other countries. 3M has come back in a statement saying, look, we had export orders for Canada, for Latin America. It could backfire if we ban these orders. They're mainly meant for healthcare workers and frontline healthcare workers, but also other countries could restrict their supply. Well, the White House has said, no, they are invoking the Defense Purchasing Act and essentially saying that companies cannot export these or other medical equipment without the say-so of the White House. Quite an incredible move. And the question is, will other countries move to limit supplies into the US instead of opening the gates for help? It could be a problem. Now, the one exception to that, of course, is the scientific community. You are seeing more and more consultations, not just on vaccines and therapeutics, but also lessons learned. For example, doctors here in the United States talking to doctors in Wuhan, like you've seen in Italy and elsewhere. So that on the scientific level, much more sharing, but politics is politics, and it's all local, isn't it?
Yeah, very interesting. Thanks so much, Nathan.
Thanks again.
CGTN's Nathan King reporting from the White House there. Earlier, I spoke with Kink Omar. She's a nurse practitioner and recovering coronavirus patient. She became ill in early March at her home in Nashville. I began by asking her to describe those early symptoms.
My first symptoms were a dry cough, fever, chills, body aches, and then as the days progressed, I got more and more fatigued easily.
And so you went to the doctor, and the initial diagnosis was not that you had the coronavirus, right?
Yeah, initially my doctor and I both thought that I had maybe some sort of bacterial infection, and that a course of antibiotics and like a steroid shot would help. But unfortunately, that did not help at all. At the time in Tennessee, there was not testing available, and so it was impossible to know if it was COVID-19.
And then things really kind of dramatically took a turn for the worse, didn't they?
Yeah, I tried to self-manage at home as much as I could. About 8 days into being sick, and this is 8 days with a fever straight, with no relief, I went into an urgent care center. They did a chest x-ray and told me that I had pneumonia and that I should go to my nearest ER, and that's when I went into the emergency room.
And so I have to think, and you're in the healthcare profession, I mean, you've gone to see your doctor, you go to this place, all these different people you're coming in contact with, and still at some point you still hadn't gotten the test. Did you think about this afterwards, about how many other people who may have come in contact with you and the potential for infection?
Yeah, definitely. That's something that's very difficult as a healthcare worker and just as, a community member. They say that you are contagious for up to 2 weeks before you start showing symptoms. And in that 2 weeks, I lived a normal life. I went to the gym, I went to the grocery store, I worked at the hospital. And so I do worry that I could have possibly, infected other people. But at the time, there wasn't testing available. I wasn't showing symptoms. At the very first sight of symptoms, when I had my very first fever and body aches, I isolated myself in the house in one room for the entire 8 days until I went to the hospital.
So when you got the diagnosis, pneumonia, I mean, that's scary stuff. I've had it a couple of times. I mean, you really can't breathe. It's really tough. What's going through your mind, and what was it the doctor suggested you might take?
Yeah, so when they did the chest x-ray and thought that I had pneumonia and they told me to go to the ER, at the time I still really didn't consider that I possibly had, COVID-19. I thought, what are the odds that I'm going to get it out of every Tennessean? Why me? And so it is scary, especially because the fatigue starts to kick in with pneumonia. I had to stand for just a couple minutes while they were doing my chest x-rays, and I remember midway through just a few minutes telling the technician, I have to sit down, I can't stand for this long, and it was in actuality probably like 3 or 4 minutes that I was standing. So that's when I decided, when they told me to go to the emergency room, and it is nerve-wracking because, you're so sick and you don't know what's making you so sick.
And the malaria drugs, I guess that you tried this experiment and it worked, right?
So when I went into the hospital after my test came back as positive, I spoke with the infectious disease doctor who, was very straightforward with me and very blunt, and told me that these drugs had been used in Europe. They didn't have any studies to show that they, have been proven to work, but that this was the only treatment option available, and was I willing to try it. And, at that point I was so sick and I felt so miserable, I would have been willing to try anything really. I know what these medications are just being a nurse, but it was still scary starting medications that haven't been proven, to help with something yet. And then they have side effects as well.
But you did start to feel a little better. Was it a gradual thing?
Yeah, I will say that after my first dose of the hydroxychloroquine and azithromycin combination, after I started taking that medicine, that was the first time that I went fever-free for 24 hours.
And I can't,
in a 10-day span.
Yeah, and one of the things I guess it's worth pointing out is you still really have no idea how you got it, right?
I have no idea. I would do anything to know exactly, who I interacted with or what I touched or, who I was around. But it's impossible to know. I wish I did. I wish I knew.
You chronicled your story in WebMD, and one of the things that jumped off the page to me, and I think it's really worth pointing out. I mean, you're 31, you're in great health. You work out, you're a healthcare provider. I mean, if anybody understands all this stuff, it's you. And you wrote, "If I can get it, anyone can." And I'm sure, you know, you watch the news, seeing these kids down in Miami, out on the beach, having a great old time and kind of laughing about it. There's coronavirus parties in places like Kentucky where people actually came up with COVID-19. What are your thoughts when you see all of this?
You know, it's so disappointing to see people doing things like that and not taking it seriously, because at the end of the day, we are responsible for each other. We have to help each other in this. This is not something that only affects the person that makes that decision to go into those types of events. It affects their entire community, their entire state. And, you know, this is something that we have to care for our neighbor about. You know, I'm a healthy 31-year-old and I was able to battle coronavirus, but my parents are in their 50s and maybe they won't be so lucky. So we have to be really careful and we really have to look out for each other.
You mentioned your parents. I think one of the most poignant parts of the story is that walk down the stairs. What was that like to go down and finally be able to hug your mom after so many days?
Yeah, you know, it's something that we take for granted so much. We're a very close family, but you know, to be isolated by yourself for at that point almost 3 weeks, it's very difficult. And you know, it was something that we both desperately wanted and needed, and it felt great.
And I guess one of the questions is, you know, how long before you know that you can actually walk down the stairs? I mean, that yearning, that wanting that physical connection, I'm sure you want to go down there, but also you don't want to infect a loved one, and you still have a bit of the cough left. We just heard that.
Yeah.
How do you know when to go down, and that mental part, how did you overcome it? Because it really is a big piece of this, isn't it?
It is. It's a huge part of it. You know, I was fortunate that when I was in the hospital, the day that I was leaving, it had been 15 days since my first symptom, and they say you're contagious for about 2 weeks, which is why they asked people to quarantine themselves for 14 days. So I was past that point. They asked if they could do a follow-up nasal swab to test me again. So my second swab after my course of treatment in the hospital came back negative. So they told me that I was clear and not, you know, to live a normal life, or, you know, as normal as can be, all things considered. So I also reached out to the state health department that told me I could also lead a normal life at that point since my test was negative. But, you know, me just being the careful person that I am, I still isolated myself for 3 to 4 days after coming home, just to be on the safe side. But the cough is, you know, I still have the cough, and they told me that the cough will last about 6 to 8 weeks.
I've got to ask you one final question. I spoke to a doctor earlier this week who was talking about the Midwest, and that, you know, the the issue of the coronavirus flooding through areas in rural areas, and you're in Tennessee in the South. He was talking about Mississippi, Alabama, the Midwest, that the healthcare systems are not as advanced as what you might find in New York City or Los Angeles. And this fear, this concern that once it starts spreading into these kinds of communities, it's going to be devastating. I want to ask you about your thoughts about your state of Tennessee and some of these southern states. Are they equipped to deal with this once the onslaught occurs?
Unfortunately, I don't think that any of these cities are prepared for a rise in hospitalizations. We just don't have the capacity at our hospitals to be able to handle a mass influx of patients. We are fortunate in Nashville that Nashville is like a healthcare hub and we have many hospitals. But, you know, the truth is in rural areas in Tennessee and rural areas in Mississippi, Kentucky, these hospitals have shut down in large numbers over the past several years. And so, you know, I really am concerned for people that simply just won't have the access to healthcare, the people that need to drive an hour or two just to get to a hospital.
King Omar, thanks so much for talking to us. We're really happy that you're doing better. Hope that cough goes away soon. Can't thank you enough.
Thank you so much.
Well, there's a lot to talk about here. Let's get right to our panel. Arthur Dong is a professor at Georgetown University School of Business right here in Washington, D.C. With us from Beijing, Victor Gao. He's a CGTN commentator and vice president of the Center for China and Globalization. And Gavin Macgregor-Skinner is at the director of the Global Biorisk Advisory Council and a global health security advisor. Gavin, why don't I start with you? I think King's story is really interesting. She took these anti-malarial drugs. The U.S. president, of course, sees that as a silver bullet. Anthony Fauci says there needs to be more research about it. I want to get your thoughts on that. And also, you know, this lingering feeling that you have. I mean, she's saying that this cough's going to be there for another 6 to 8 weeks. She's young, healthy. This thing really kind of hangs on, doesn't it?
Yes, it does. And I've probably seen over 500 patients now. And those patients that I've seen that have recovered, been discharged from hospital, still have fatigue, still have that cough. And I've seen patients up to 4 to 6 weeks after being discharged, still not feeling 100%. With the treatment for chloroquine, I lived in Africa for many years. Chloroquine was used for malaria, and I know that it can cause adverse effects. But also toxicity. And I've seen a number of patients when I worked in Africa that had toxicity effects from taking chloroquine. So again, we still need to get more data, more information, and be very careful what we prescribe. But again, prescriptions are being made by physicians, by doctors in our healthcare system on a patient-by-patient decision-making process.
Yeah, and each case different. So some cases may be good, others, as you point out, there's some risk there as well. Victor, we are getting some good news from China, though. A group of Chinese scientists are studying several antibodies. They say that they're extremely effective in terms of blocking the coronavirus from hitting those cells, entering cells. Let's hear from Professor Zhang Lingqi.
The importance of antibodies has been proven in the world of medicine for decades now. They can be used to treat cancer, autoimmune diseases, and infectious diseases. So among the first 20 or so antibodies we tested, we found 2 to 4 able to block viral entry in an exceedingly powerful fashion.
So, Victor, how encouraging is this?
I think doctors and scientists, virologists throughout China and throughout the world are working very hectically, try to find a solution to this COVID-19. And it is a major effort involving many, many different chapters. You are talking about vaccine, for example. You're talking about therapy. You're talking about the solution. You're talking about quarantine, better means to implement quarantine. So you name it. And I think China, because China was the biggest hit country to start with for many, many weeks until very recently, the Chinese doctors and scientists are fully mobilized. I think they are working day and night, try to find the final solution for this very, very dangerous pandemic. And I hope international cooperation, as you just now mentioned, between the Chinese, the Americans, the Europeans, the Japanese, and you name it, throughout the country, throughout the world, can be intensified. There should be no political roadblocks for international cooperation in the science and technology side, as well as in the cure side, in the prevention side.
Gavin, I want to get your thoughts on these antibodies as well. Could they be fast-tracked, mass-produced, get into wide circulation quickly, or is this going to take a lot of time? And then there's also this reporting that there's a 100-year-old tuberculosis drug that might also be a remedy. What are you seeing out there on the landscape that gives you encouragement?
This is very similar to the experience I had when I dealt with Ebola patients back in 2014. But if I can give you a little bit of an overview of what my day looked like today, Friday, having worked in the hospital all day, we spoke to the hospitals in 5 different states, sharing information, sharing stories, sharing experience, learning from each other. I also spoke to hospitals in France, Germany, Italy, and also Ecuador today. So again, the communication that's happening both in the US as well as internationally between hospital staff, laboratorians, research scientists is pretty amazing. It's phenomenal. And everyone is working just like it's been stated, very hard, long hours every day, trying to come up with a lot of the solutions to a whole list of challenges we still have, both on diagnostics, symptoms, patient care, patient safety, as well as looking at what treatment regimens we could use.
So, Gavin, give us a sense, what are those conversations like? Because these are tough days, aren't they?
They are. They're long days, they're tough days, but again, I work with wonderful people. And again, a conversation today was how long are you wearing your mask for? How many times are you reusing your mask? How are you cleaning or disinfecting your mask? How are you focusing on provider safety in the hospital? Have you tried this treatment? So we're actually sharing notes, and we do this through different channels that we use that again are encrypted. They're private. We ensure that no patient data is released publicly, but we do it, and we're doing it on a scale that I haven't seen before. Again, every morning something else has happened in some other country or some other hospital where someone said, "Hey, we tried this with a patient, and this is what happened." And then straight away we get onto a conference call and we share notes, and then we talk about what would we do in a similar situation.
Arthur, there's the healthcare piece, and of course, there's the economic piece to all of this as well. And we're seeing so many people out of work. We're seeing small businesses really struggling. The administration starting up this effort today to try and help small businesses, but a lot of people saying the online effort clunky, the infrastructure may not be what it needs to be. The economy seems to be cratering. Give us your sense of how things look in that landscape.
Yeah, yes, Michael. The manner in which you just described the impact of coronavirus across the global economy is quite serious indeed. This is going to cut a swath across the American economy as well as the broader global economy with the force of a Force 5 hurricane. What we're seeing is a collapse in both supply and demand. Now, if we look back to the 2008 financial crisis, what we saw was a collapse in demand, but supply remained intact, and factories were indeed able to continue producing. What we're seeing today is something on an order of magnitude as completely unprecedented in the post-war era. And indeed, reflections of the Great Depression of the 30s are starting to come forward. What we're looking at is an impact in terms of employment in the United States, both voluntary and involuntary, meaning that companies and retailers of all manner have been forced to shut down. Layoffs on the order of magnitude in the modern era that we have not seen. Already the number of unemployed has already eclipsed the numbers of 2008. And there are estimates from very respectable economic analysts that are projecting total unemployment in the United States to range somewhere between 10 and 20%. And of course, this is going to impact those that are occupied in small businesses who account for the greatest majority of jobs in the United States. It's those companies that employ less than 100 people, many of whom are now out of work. So if you think about, the normal sort of activities that are a part of everyday routines in the American economy, such as going to your hairdresser, going to the nail salon, going to the dry cleaner, and certainly going to the restaurants, well, all of them have been closed. And as a result, I can only imagine the degree of tension as well as fear, where a lot of families in America are wondering, where am I going to get my next meal?
Arthur, you mentioned Great Depression. I can remember my mom, obviously I didn't live through it, but she did, and she said, you have no idea. You have no idea how bad this was. We may be getting an idea, so just how bad will this be and how long will it last?
That's a great question, Michael. And only asking people like your grandparents who have lived through a Depression era sort of setback and shock, you could see that it changes their behavior for the rest of their lives. From that point forward, when you go through such an experience, your behavior economically with regard to your own personal spending, with regard to your finances, that may be fundamentally changed for the balance of your life. And so there are some estimates that are stating, analysts are out there stating that this is not going to be a V-shaped recovery, by no means, and that the economic impact, certainly here in America, is going to persist through 2020 and perhaps even through 2021, late in 2021, when we finally see maybe some glimpses of recovery. So the damage is going to be widespread.
And Victor, let me ask you about from an economic standpoint in China. Of course, joblessness is an issue there. A chief economist at fund manager Upright Asset says he thinks somewhere in the neighborhood of 205 million Chinese workers can't find jobs or are unable to return to their jobs. The service sector obviously hard hit. South China Morning Post saying 27.4 million urban workers are sidelined. Give me a sense of just how bad it is there.
Absolutely. I think starting from January, in the middle of this fight against coronavirus 19, the Chinese government's efforts, the national efforts in China are all focused on containment, on cutting off the spread chain, for example. And as a result, most of the factories are closed down and productions are being interrupted. Supply chains are being very much overwhelmed, for example. And I would say the month of February, according to my personal estimate, China as a whole probably lost about 20 working days as a whole. And so you see a lot of disruptions. And also, one worst situation happened in the agricultural field because agriculture is very seasonal. If you miss one season, for example, if you miss a couple of weeks, then you lose the whole season. And then it may have an impact on the rest of the year. And I think China has put the top priority on saving lives. And the government has been talking about don't care about the negative impact on the economy as a whole for a while. Let's focus on fighting against the coronavirus. And the Chinese premier, for example, on several occasions has been saying for the rest of the year, the very important criteria is to maintain jobs. Don't see a situation where many, many jobs will be lost. So China is caught up in this very difficult situation. You may know for more than 40 years, the GDP growth annually has been very robust in China, the highest in probably written history in mankind. However, for this year, I think the 2020 GDP growth will be very, very poor. It probably will be half of the projected number, around 6%. So it probably will end up with 3% or so. However, the government now is really trying its best to restart the economy and making sure that the migrant workers who went back home before the Chinese New Year and found it very, very difficult to get their acts together and go back to the coastal cities, major employment centers, for example, to work. So different government agencies are now organizing special going back to work, buses, high-speed trains, airplanes, etc. The key is to go back to work in a safe way and avoiding the spread of coronavirus.
Gavin, let me ask you about what we've seen. Everyone's kind of complaining about kind of the schizophrenic approach that the administration has had. Even today, it's okay if you wear a mask, maybe you should, maybe you shouldn't. The president says, I'm not going to. We're hearing a lot of different states going in different directions. Should there be more of a cohesive national approach to this?
Well, I think what I'm seeing at the local community level, at the county levels, people are volunteering at a level we've never seen before. Communities are coming together where neighbors are helping neighbors. I know so many of my neighbors know that I work in a hospital. They're helping me, helping my family and helping others. We had 6 people last week that were stuck in bed with COVID-19 disease. They were lab positive. All the neighbors got together to help them with groceries and medications and other things that they needed for day-to-day living. So I see that at that sort of that local neighborhood level, people are doing a really amazing work and amazing job at bringing the community together.
We're going to have to leave it there. Gavin, thanks so much. I want to thank all of our panelists. Really appreciate it. And that is it for this edition of The Heat. I'm Mike Walter, Washington, D.C. Thanks for watching.